rock in the kidney. And most people will have, if they have any type of association with one, they know it as a very painful type of solid structure that they end up passing. A lot of times people think it's the type of water. Some people have well water here, and so a lot of times they talk to me about, oh doctor, it's the hardness of my water. That's not really it. There are certain areas, in Oklahoma being one, that are just stone belts. The hydration levels, the level how much fluid people have, dietary causes, sometimes surgical causes, bypass surgeries, things like that. Those are the reasons people form stones, but it's not the type of water. It's either the hydration state, which is the big one here. Sunny areas where you have a lot of sun. It could be from either supplemental things like too much calcium, vitamin D, and sun increases vitamin D, which increases intestinal absorption of calcium. And those are the reasons for the Bible Belt in this area being high stone areas. If you are basically dehydrated to a certain level, and with our dietary intake, these particles or sand-like structures precipitate, they come together, start sticking together, positive, negative charges, and that's how stones are formed. So drink enough, that's what it does. It takes those particles and they can dissolve. But if you have a low amount of fluid, they don't. There's been studies to show that it really doesn't matter so much the type of fluids, it's the hydration state. In other words, again, definitely want to incorporate some water, but if you're drinking on a regular basis, whether it's any type of liquid, they did studies and it really didn't show that it increased the stone formations. It was all about the hydration state. High protein increases some of the dietary products that increase stone formation. Your kidney is connected by a tube, your ureter, that drains into your bladder. And there's about 3 areas that a stone could be hung up or get stuck, as we say in my office to make it simple. Where the ureter first comes from the kidney and turns into the tube, there's a narrowing there. As it crosses across the blood vessel, there's another area that stones can get stuck. And as it comes down low into the bladder, that's the 3rd spot. But what I tell people, if you have a stone that's less than 5 millimeters, so you take 2 BBs, that's about 4 millimeters. So 2.5 BBs, height and width, that's what I tell people, you should be able to pass that. Some of these stones can be smooth as river rocks. There's jack stones that can have peaks on them, and in this area people call cockburrs. The points scrape and cut, and that's why it can bleed and they hurt. Or you can just kind of have a mulberry type of a stone. Your body is very smart, and it's not going to continue to make urine, and your body will start shutting that kidney down, whatever side it's on. And so because there's not more urine been manufactured on that side of the kidney, you don't have the signs of the pressure and pain. So my pain's better, that means I'm better. Well, no. And that's a problem. Your body will start shutting down function on that side. Your other kidney will double function and you're better, but you're not better because your kidney's still obstructed. And so if you've been diagnosed with a kidney stone or seen in the emergency room, you need to follow up with the doctor, primary care, preferably urologist if you've been referred to. That just because you're better doesn't mean you're better. And that's where we get into people who can lose their kidney because of long-term obstruction. It used to be, we didn't have scopes to reach stones, so that was an open case. We had to physically cut people to go in and get a stone. So now we have the luxury of outside the body blasting, nice narrow scopes where we can go through the urethra or the urine tube, get into the kidney, and minimally invasive outpatient surgery. So, the treatment and the surgery part has really changed. Maintain calcium levels. Supplemental calcium is good. You don't have to, there's a certain normal amount. It varies from for women and men, but roughly between 800 to 1,000 milligrams is safe. If you're a person that just has a repeated stone formation, then you may just don't want to take supplemental calcium, but you can still drink milk products, eat foods that have calcium in it, but don't take the supplemental things. And that's one of the misnomers I'd like people to know about, because I see that, and that from home remedies or someone told them or a friend, just cut out all that, and then that will take care of it. Well, that can cause a problem to be worse. So that would be one of the take-home messages I'd like to give people. Do not stop all your calcium intake.